First, you'll hear from Dr. Saqib Mukhtar, and I'm going to formally introduce all three speakers on the next slide, but just to give some of the overall topics, he's going to be giving kind of a message to IFAS extension and sort of the role of IFAS extension during these challenging times and as we respond to COVID-19. Then you will hear from Dr. Ricky Telg. He will introduce available resources to inform agricultural producers and farm workers about COVID-19 protection guidelines. Also, he will briefly present some of the available resources. And then lastly, you'll hear from Dr. Cindy Prince, who will be able to provide that the health information and any questions that are more related to the infectious disease and from more of a health professional perspective. And then we'll have time for Q&A. So we'll go to the next slide. I'll introduce our three speakers at this time. So first, you'll hear from Dr. Saqib Mukhtar. He's the Associate Dean for Extension, also the Agriculture and Natural Resources Program Leader here at the University of Florida. Next, you'll hear from Dr. Ricky Telg, Professor in the Department of Agricultural Education and Communication, Director for the Center for Public Issues Education here at the University of Florida as well. And then Dr. Cindy Prince is the Assistant Dean for Educational Affairs in the College of Public Health and Health Professions at the University of Florida. So we're very pleased to have all three of our speakers with us today. We're pleased to have all of our participants as well. So at this time, I will pass off the microphone to Dr. Saqib Mukhtar.
Thank you very much, Philip. And on behalf of the University of Florida Institute of Food and Agricultural Sciences Extension, I would like to welcome all the participants of this excellent webinar that we're going to present to you with help from our colleagues from the Southeast Coastal Center for Ag Safety and Health, otherwise also known as the Ag Safety Center. I just wanted to thank you for participating. As you know, that in the state of Florida and many other southeastern states, we grow close to about 300 commodities. And so agriculture is a year-round operation. And then when, unfortunately, we are dealing with COVID, this pandemic, it is extremely important that we come up with educational materials and methods to get this message across that COVID safety and precautions based on the CDC latest guidelines is our #1 priority to protect not only the farm workers, but also the crew leaders and all the other folks, growers and others who are involved in our agricultural operations. So I want to commend the center for coming up with this electronic toolkit for extension, which is a one-stop shop for messaging and putting the educational materials out to our clients out in the farms, our growers and others. One more thing I wanted to emphasize upon was that since these are the most latest CDC guidelines, I would ask all of our educators to please stay within those CDC guidelines when you do your training. You're excellent, excellent educators, and I'm proud of every one of you. So stay within those CDC guidelines. When if you have any questions that are medical related, for example, if you need an epidemiologist to answer those questions, refrain from answering those questions. We will provide you a contact. We already have Dr. Cindy Prince. She will be our speaker today, and she will provide you a contact. She has been very kind to offer her services for answering any of your medical related questions when it comes to COVID-19, and our farm workers and others who are working day and night on our farms to keep the food security and on top of their list, and good food abundance on top of their list. So with that, I want to thank you all again for joining us, and I will pass the mic on to Dr. Ricky Telg.
Great. Well, thank you so much, Dr. Mukhtar. I'm glad to be here this afternoon to my part of this presentation is to introduce you to some of these educational materials that were referenced earlier that you can use in presentations. Some are ready-made. for you to present. Others are videos that you could provide electronically to some of your clientele. So I'm going to give you a brief overview of the materials. I do want to mention that because we are trying to get these materials out into the field as quickly as possible, there are a couple of things that are still in production, and I'll mention that a little later on in this presentation. But we're trying to get these needed educational components out to our clientele, both here in Florida as well as throughout the Southeast. Hopefully we have several people from other states joining us today to learn what we have available for educational purposes. So before we get into the actual materials, I wanted to give everyone, of course, a little bit of a background. I'm sure this is very familiar to all of us who work in extension and in agriculture and natural resources, but because of COVID-19, the Centers for Disease Control and Prevention, or as we know, the CDC, has guidelines for agricultural workers and employers. And if you go to that website that you see there, you will get all of these key topics. I just picked out a few of them that are on this very long web document, including exposure, developing a COVID-19 assessment and control plan, how to manage sick workers, and addressing workers who return back to work. They also address transportation and housing. And that one bullet point that you see at the very bottom in the yellow highlight, that's really what the focus is today, because the CDC does say that training needs to be a component of how to keep agricultural workers and employers safe from COVID-19. So hopefully today we'll learn a little bit more about what we have available to you. As also already referenced, the Southeastern Coastal Center for Agricultural Health and Safety have curated resources related to COVID-19. What we've tried not to do is to create a lot of things on our own, because we want to stay very close to what the CDC has already established. But what we've done is that we pull together all these resources that we think are most appropriate for our audience here in the Southeast into one location. So many of the materials are also in Spanish. We have a few materials that are also in Haitian Creole, and these materials range from social media to fact sheets, infographics, posters, PowerPoint slides. And if you visit the website that you see there at the very bottom, you'll come to this page that's on COVID-19. And so just to kind of give you an idea, I've done a few screen captures of this page. So when you get to the page, the first thing you'll see after the first introductory paragraph at the top of the website are these drop-down menus. And I wanted to bring this to your attention because if you're not familiar with how this works, you may think, well, where are the materials? So each one of these gray boxes is a drop-down link. And so you have to click on the drop-down link for it to expand. And so the first one at the very top of the page is recommendations overall, one on risk prevention, communication resources, and then there's one at the bottom of the top part of the web page on extension resources. Now, we're going to come back to the middle part of the page, of the web page, because that's where we'll focus most of my time today on the toolkit. But if you keep scrolling down the page, you'll see that we also have curated or brought together resources ranging from the CDC, FEMA, departments of health for all of these states in the Southeastern region, as well as the departments of agriculture. And we've tried to link those specifically to pages in your departments of ag, state departments of ag, where they're talking about COVID-19 and agriculture, as well as agricultural health organizations, farm worker advocacy groups. And we also have a link to the UF-IFAS EDIS and materials. Again, we'll talk a little bit more about that because many of these materials are not only in English and Spanish, they're also in Haitian Creole. Scrolling even further down the page, again, pulling together resources that we think are most appropriate. And this screen capture doesn't provide all of them, but some of the materials that you can print out. There's also videos from the CDC as well as from our center that we've created based on the CDC guidelines, and we'll show a few of the, show one of the videos a little bit later on today. Okay? So that kind of pulls you through the entire page, except for the middle of the page, which is what today's primary focus is on, which is our new toolkit for extension working with related to COVID-19. And so in this toolkit, it's right below the Extension Resources tab, or if you go to the very top of the page, there is a direct link to this in the middle of the page. You'll see this document. And so this is actually a flip book, so you can actually click on the little buttons on the right and left-hand side of the toolkit to look at different pages. You can also, of course, download the entire toolkit document, which has active links to all the materials by clicking on the link there that you see with the yellow arrow. And then there's another page, which I will discuss in just a few minutes, that will take you to another page under the IFAS Extension Administration page, which has all of the PowerPoint slides in English and Spanish, which I'll highlight in just a second, with the IFAS extension logo and design on it. So we did this because the materials that we have created in the Ag Safety Center are regional in scope, because we are a regional center. But as Dr. Mukhtar has mentioned already, we felt the need for IFAS extension to also have its own look in this very important message to get out to farm workers, to crew leaders and employers. So by clicking on that specific link, you'll be taken to the IFAS Extension Administration page that has also some COVID-19 resources, and you can use the specific IFAS Extension PowerPoint slides that are based directly on what you'll see in just a second. So hopefully that makes sense. If not, follow with me for the next 15 minutes or so, and hopefully everything will make perfect sense by that time. So the toolkit components overall, again, as I said, have this booklet with links to all the materials. Kind of the foundation for all of this is the PowerPoint slide sets, both in English and Spanish, and all of these also have scripts in the notes view. So really, if you are uncomfortable with this topic of COVID-19, you can just read the script and present this information. It's written in such a way that it's fairly conversational, so you can present that in English and Spanish. We've also created these PowerPoint slides as videos in English and in Spanish. So in case you want to provide a link directly to the YouTube videos in English and Spanish, you could do so in your educational presentations. As I mentioned already, we have some short CDC guideline videos. We'll show one of those today, and then the print materials. So I do want to take a second here to mention that all of the materials that you'll be seeing today have been NIOSH approved. That's the National Institute for Occupational Safety and Health. NIOSH is a component of the CDC. There are other regional agricultural health and safety centers across the country, including ours here in the Southeast. And so all of the PowerPoint slide content and the scripts were NIOSH approved, vetted by all the other ag safety centers across the country. So if you use just the PowerPoints or the PowerPoint slide videos, everything that is there has been approved by all the other ag safety centers across the country, which is very helpful to know that this material has been vetted on a national level. So again, here's what the booklet looks like. It's 8 pages, and we'll look at each one of these in just a second. The first page or two is an overview of what the toolkit includes, as well as how to go about using the material. The next pages are the PowerPoint slides, kind of giving you an overview of what the slide set does, both in English and in Spanish, as well as another page on the actual PowerPoint videos. Now, for the next few minutes, I'm just going to show you a few examples of these materials along the way. First, we'll start with as I said, kind of the core or foundation of all these materials is the PowerPoint slides. What you see here is a screen capture of one of the slides in English. And at the bottom of that screen, there is the English version of the script, if you want to present it in English. And every page, every slide that we have in the PowerPoint slide set is also provided in Spanish. All the text on the slides are in Spanish, and the script itself is in Spanish. I also want to mention with the Spanish translations is we contracted with a company that specializes in translations. And so everything that you see here in the English, I'm sorry, in the Spanish version of the PowerPoint slides, as well as the entire script, is Spanish certified. So if you've done a lot of translation, you know that's very important because different Spanish regions have regional different dialects. So this is certified Spanish translation by this company that specializes in this area. So again, we're trying to make this as understandable and as helpful as possible. Here are a couple of examples of the Spanish slides, and you'll also see that the graphics that are used with the Spanish version are also in Spanish. So we went through and we pulled all of the CDC graphics that are in Spanish, and we inserted those into the Spanish translation so that you don't see a mix of Spanish as well as like the English graphics or CDC materials there. Everything there is in Spanish. As far as the videos go, you see there side by side the English and the Spanish versions. The English is about 30 minutes. The Spanish version, because the translation is longer, takes a little bit more time to read, is right around 33 minutes. And as you can see on the slides there, or the screen capture of the YouTube videos, not only are the slides themselves in English or Spanish, but also the closed captions are in English and in the certified translation of Spanish there at the bottom. We also have, as I said, some very short videos that we've created here in the Center for Public Issues Education, or PI Center, and we're part of the Ag Safety Center. And so there are one that's only in English, the other two are in English and Spanish. The longest one is only about 1 minute and 40 seconds long. The other two are roughly 30 to 40 seconds. And so what these can do is you can insert these into a face-to-face presentation if you'd like. Or what we also hope that you would want to do is to use this as in social media. These again are links to the toolkit. And so if you wanted to get word out to a specific audience and wanted to use video, because as we know, video is where a lot of things are going online and in social media, these could be very helpful to help spread the information about how not to spread COVID-19. And before we go any further, I think that we have queued up one of the short videos. I'm going to ask Philip if you want to go ahead and override me and show one of the videos, and then we'll move on from there. Well, that gives you an idea of what the videos look like with music and with text in English or in Spanish. Again, something that could be easily provided in a presentation, or if you wanted to link or to provide this to individuals as social media. Next are the print materials. This is on page 7 of the toolkit, and as I said previously, all of the links on the downloadable toolkit are active links, so all you have to do is click on them and they will take you to these materials. As I mentioned, on the entire curated web page, there are many, many more resources available, many more print documents, more videos. There are also some radio PSAs on the overall web document. What we've tried to do here in the toolkit is to curate the curated materials down to what we think would be most helpful to you as you're making a presentation to individuals in a very short time. So of all the materials we pulled together, the ones that you see there under the print material banner are those we think that are probably most helpful to you in English and in Spanish. So you click on any of those, it will take you to those links that you can download. You need to print them off, you can do so, or provide a link to your attendees so they can download later. I do want to mention that last bottom row of information there. This was actually something that our partners in agricultural industry in the state of Florida had asked, is that they said that they don't have a lot of material that they can post related to how to stop the spread. And so we had approval from UF Health here at the University of Florida to take what they have done that has the University of Florida look to it and created these materials in English and in Spanish and in Haitian Creole. So again, something that can be linked to, downloaded, printed off, and then they could post that in areas around the workplace so that their workers will have a better idea of how to protect themselves from COVID-19. So again, all those are in your toolkit. What we are trying to do with especially the PowerPoint slide presentation is to have this serve as a base for your presentation, that you can adapt the presentation based on the audience. The primary audience for this is really more the farm crew leaders who could then present this for you as an extension faculty member to present this to crew leaders who would then distribute the information, or it can be adapted for an audience specifically who is a farm worker. So we do want you to know that we hope that you can use this information, this PowerPoint presentation as a base, and to use and to adapt it as you see fit. The overall presentation, as you see there with the different bullet points, covers many topics ranging from symptoms of COVID, transportation issues, eye protection, how to clean and disinfect equipment, hand washing, what to do if an employee becomes sick, even children and youth on the work site. Because, as I said, this was a national slide set presentation. We're trying to cover all different areas, including different ages who might be at risk of contracting COVID-19 on a farm work site. So the next few slides are just some screen captures of some of the materials, beginning with the introductory slide. And what I've done here with the screen capture is to provide you with a look of the PowerPoint slide, as well as what some of the notes view looks like with the script. Please understand that what you see there is only one segment of the notes view on most of these slides. They can go much longer than what you'll see with the screen captures. Again, physical distancing or social distancing on the farm. This is the English version of the Spanish slide that we saw previously. Not only do we talk about face coverings, but what to do about washing face coverings, because that will be important for a farm worker audience. Washing hands is a large component of the overall slideshow presentation. Avoiding sharing tools because of the risk of contracting COVID that way. Transportation is a huge issue, as we know, in the agricultural workforce with workers. So there is information there as well. As I've mentioned already, we have these tools, the PowerPoint slides, both in the Ag Safety Center version, which can be used at any location across the Southeast, or even nationally for that matter. We also have a version of it that has been provided or being created actually even as we speak for IFAS extension. So you can go to that site by going to the Extension Resources tab and then clicking on the link that you see there, the circle in purple, or go to just the toolkit itself and click on the Grower and Worker Education web page. You'll be taken to the IFAS extension administration page that also has really great resources on COVID-19. Going a little bit further on the page, you'll see that there, where it says training materials, that English presentation and that Spanish presentation are the versions that will have an IFAS extension look about it. I would ask this, don't go there just yet. We're hoping to have those presentations up by the end of today. We're still working on getting the Spanish version up on the page, but the English version, once it's up, will look like this, where all the materials that you saw previously in the PowerPoint slides have now gotten an IFAS extension look to them. So again, I'll click through some of the screen captures of these slides to kind of give you an idea of what they would look like under the IFAS extension version of the slide set. The last thing I want to mention before open up for questions is this, that the evaluation team for our Ag Safety Center, who is headed by Dr. Sebastian Galindo and Dr. Glenn Israel, are developing evaluation instruments so that you can use these instruments and include them as part of your presentation. So they're creating 3 different evaluation instruments. One is to capture the reactions and perceptions of those who are being trained on the material. The other, which is probably the most critical for you as presenters, is an evaluation instrument to capture the reactions and perceptions of farm workers and farmers who are being reached by these materials. So when you're doing a presentation, you can use this form of the evaluation for them. They're working both on a paper and pencil version as well as a Qualtrics version. So if you choose to use the Qualtrics version at the end of a presentation, your people who will be trained in that workshop will be able to do this in Qualtrics, and Dr. Galindo will be able to provide you with the information almost immediately from your presentations those days. What we're trying to do is to collect the information as best as we can to provide updated and enhanced information, as well as to help you in your report of activities at the end of the year by saying, these are the number of people who participated in this presentation, as well as what they thought and what they learned. And so the last piece there is that kind of as a follow-up for those in extension and others who may be using them as these materials, to capture their perceptions about the quality and effectiveness of the materials after you've done the presentation. So as I said, those are being finished now. And so I just heard that the Spanish and English versions of the PowerPoint slides are now available there too on the extension website. So with that, I'm going to stop for a second before we get to Dr. Prince and see if there are any specific questions folks might have about the toolkit or any of the resources that are either on the IFAS Extension Administration site or the curated Southeastern Coastal Center for Agricultural Health and Safety site. I know that's a lot of information. Okay, if not, what I would say is this, is I'm gonna turn it over to Dr. Cindy Prince. There will be time for question and answers for any or all of the topics that we're talking about today throughout. I will be watching the chat and try to facilitate some of the discussion or some of the questions that you might have related to what I talked about previously, as well as to what Dr. Prince will be talking about now. So with that, I'm gonna turn it over to Dr. Cindy Prince, who's the Assistant Dean for Educational Affairs with the U.S. College of Public Health and Health Professions.
Thank you, Dr. Talde. I appreciate that. And I just wanted to take an opportunity to introduce myself, tell you a little bit about my background, and then hopefully about how I can potentially help out if there are questions. So by background, I trained as a virologist, as a lab scientist, and then from there did a Master of Public Health in Epidemiology. And after that, I worked in infection prevention and control at UF Health Shands for about 4 years before joining the faculty in epidemiology at UF. So I'm kind of still living in that world of, infection control and hospital epidemiology, but now we're really applying that across the board in this COVID-19 time to all of the different activities that people are trying to undertake and stay safe while they're doing them. So I'm not a physician, and if you have medical questions, you can certainly send them my way, and I will try to find someone who can answer them for you. But really for me, I'm probably going to be more helpful with things like risk assessment, with infection prevention and follow up on that. And you can see that my email address is posted there, cap5@ufl.edu. So please don't hesitate to reach out to me as questions arise and you'd like some advice on how to go about things. couple of things I wanted to talk about right now as we're waiting for questions to pop up on the chat. One thing is about masks. So as I've been, actually I've just transitioned into a role on campus to do some campus infection control and seeing a lot of questions about different types of masks. And obviously for our farm worker population, a cotton mask really is your best option. Those should be double layer cotton masks. We like them to at least have 2 layers on them for optimum protection or better protection. But the nice thing about those cotton masks is they are washable, and they're also going to be hopefully a little bit more breathable while people are working. There are masks that have things called an exhalation valve. So you'll see some masks that have plastic discs or plastic squares on the front, and those are actually masks that allow people to breathe out without that exhalation being filtered. So when someone's wearing that type of mask, you're not protected from them because their air is not being filtered through the mask. So I just want people to be aware of those masks and to be able to help educate other people that those are not the type of mask that anyone should be wearing right now. Sometimes they're useful for workers in certain situations, but they're not useful when we're in the middle of a pandemic. Another thing about masks is masks need to fit properly, and it's not going to be a one-size-fits-all. And we know that, I'm sure we've all seen people who are wearing a mask, and every time they put their head down, their mask falls off their face or it falls below their nose. So making sure that people have a good fit is really important. People should be able to breathe. There should be enough room between the mask and their nose and mouth that they have some air, but also that you know, it's going to still create enough of a barrier on the top of the nose and the sides of the cheeks and under the chin, so that when they're inhaling and exhaling, that breath is actually forced through the mask and not around it. And I'm happy to answer any more questions or any questions about that if people have them. Another thing that has come up that I've heard from people, talked to people, are just some of the symptoms that are sometimes missed with COVID-19. I think that we're traditionally thinking about people having a fever and, developing a cough and that sort of thing. And, I want to just clue you into the fact that sometimes people may just have diarrhea or vomiting, and they may mistake that for food poisoning. So that's one thing that you need to think about as we're educating people. Severe fatigue can be another symptom of COVID-19. And we also hear about people just having a stuffy nose, but also stuffy and runny nose. And again, those are things that we think, well, this may be allergies, but you have to be clued in that that could also be symptoms of COVID-19. So I'm seeing some things in the chat. It looks like the chat is open. So I'm going to take a break, and I guess we're going to turn it over to a Q&A now. Is that correct?
Yeah, I think that's right. I think the question that we have right now, and I apologize because I don't know that we knew that the chat, I guess, was disabled at the time. So thank you for the person who let us know about that. The chat is open. So if you have been trying to type questions in and we're not able to, please do so. I see one question there. I think this is for you, Cindy. And I think you may have already talked about this, but it says, has any research been done to determine the type of mask that is most suitable for a field worker? And you just mentioned that too, but I don't know if you have anything more that you would like to add to what you said previously.
Sure, yeah, absolutely. It's a good question. And I don't think that anyone has specifically looked at masks for field workers. But what I would say is, that cotton mask, and not just having one, but having multiple cotton masks available, hopefully during a work day. When these masks get wet, they become much less breathable, but also much less effective. So we want people to be able to switch out a mask during the day if they need to, if they're sweating a lot while they're working, or even if the mask just becomes really dirty and a little bit harder to breathe because of that. So that's one consideration, is to make sure that there's more than one option per person for a mask.
Okay, and similar to that is the type of mask and size, mesh size, that type of thing that will effectively prevent a virus from being transmitted from person to person.
Right. So, I mean, if we're talking about really effective prevention of transmission, of course, then we're talking about an N95 style mask, the type that healthcare workers are wearing. It has a very small pore size, and that actually allows prevention of a lot of these small particles. Viruses are very small. That keeps them from, being inhaled, and also can prevent them from escaping when someone is exhaling if they're infected. But that type of mask is not necessary really for the public. That's for people who are dealing with high risk, because they are absolutely being exposed to people who have COVID-19. They're in a situation where people may be coughing and sneezing and actively symptomatic with it. And then also they may be doing procedures like aerosol generating procedures, where they're really getting a lot of COVID in the air. So that type of mask is not something that would be recommended. So any type of cotton should be fine, at least, again, a double layer of cotton. We know that you can get a slightly better prevention effect if you add some more cotton layers. It makes it harder to breathe, and it does make it warmer as well. And then the main thing is just making sure that everyone's wearing a mask and maintaining that social distancing. So when folks are outside, we have a tendency to think that we don't need a mask, and we can start to come closer to each other and talk. And we don't have a lot of data on transmission in those situations. And so really we need to stay those 6 feet apart minimum outside, especially if you're going to be without a mask.
Okay, great. We have a question that I'm going to let Dr. Mukhtar help us with. Go ahead and put this on the questions, the Q&A slide here. The question is, if we wanted to do a program with a Department of Health staff person, would it be okay to have them co-present one of the UF PowerPoints with us? So let me take this from our standpoint with the Ag Safety Center slide set. I think that would be very appropriate for that. I wanted to get Dr. Mukhtar's thoughts about co-presenting with the UF or the new IFAS extension version of the PowerPoint slides.
Thank you, Dr. Tell. Yes, absolutely. If we have the Department of Health folks who are qualified to make these presentations and they can collaborate with you, absolutely. No problem there.
Great, great. We have several questions, I think, related to, again, about particle size. And so I'm just going to try to capsulize these as much as possible. Question is from the research about trials sampling aerosol particles of COVID-19. Are these particles enough to cause infection from breathing? The person is referencing a New York Times article there. So Cindy, I think this is one for you.
Yes. So yeah, this is, if people are not familiar, there was a research study done by folks here at UF recently where they went into a room where they had patients who were COVID-19 positive and symptomatic in the hospital, and they were able to actually capture COVID-19 virus from the air and from near the patient, but also from quite far away from the patient, further than we had recognized before that COVID-19 might travel from an infected person. Now, keep in mind, those patients were not wearing masks. They were, in a room where they had been for quite some time and had been breathing COVID-19 into the air. But they were able to show that that COVID-19 actually could be grown in culture. So it was what we would consider active virus. And so given that, we really have to think about, before we've always talked about droplets, right? The whole thing we talked about before was, oh, you're going to get droplets. They may fall within about 6 feet of you. We've slowly, over the past couple of months, been looking more at this airborne transmission, at the idea of virus that could get into the air, maybe in very small droplets, but the end result is the same. It can get into the air and it can travel further than we had thought about before. And yes, those can be infectious then. And again, the idea there is to really, even at a further distance, you want to be making sure that you're wearing a mask and the other person is as well.
Great. Well, this is a question that's on one of the slides too. in the presentation, but I think it's good for everyone to hear it. And again, Cindy, I think this is one for you. The question is, how often do you recommend to wash a mask when they're reusable masks for farm workers?
Yeah, absolutely. To me, I think that those masks should be washed daily if they possibly can. I think it's really important. Again, it's not just that, you know, you can be getting virus and contamination on there, but that they're going to get dirty and, you know, I think sweaty and things like that. So you just want to make sure that it is in the best shape possible. And I think that laundering it daily would be really important.
Okay. One question here is there any information about people who get infected once? Can they contract the infection again, or is there related issues about immunity, and how long does it take to develop?
Yeah, it's kind of the million-dollar question at the moment. So, and it's a great question. So, you know, we know that when people get viral infections that they often develop immunity. We don't know specifically with COVID-19 how long that immunity may last, and we're still trying to figure that out. It does seem that people develop some immunity, but we're not at a point yet where we feel comfortable saying that if someone has antibodies, they're immune to reinfection, and not at a point where we say if we know that you had a positive COVID test, that you don't have to worry about being reinfected. And hopefully that data will come along within a few months as we get further into the pandemic. But for now, we just don't know, and you have to assume the worst case scenario, which is that you can be reinfected.
Right. There's a question about educational materials related to how to put on and remove a mask. The person said he's seen many people touching the outside part of the mask to readjust it. And he says that's, to him, a source of contamination. So I will say that there are many resources, both print and video, that I've seen through the CDC as well as in the other centers. I believe that one of the slides that we have discusses that about trying not to touch the actual mask itself when you're taking on and removing the mask too.
Yes, that's critical. When you are removing the mask, you do want to make sure that you clean your hands, and then that you're removing it by the ear loops, so you're not grabbing the front of the mask. Another thing that we see a lot of people do, of course, is take the mask down to their chin, kind of make it a chin mask instead of a face mask. Maybe to take a drink of water or do something like that. I think you have to consider the outside of that mask as being contaminated, whether it is or not. Make that assumption. And from there, you know, if you need to take a drink of water, take off one of the ear loops of the mask, move it to the side, drink, and then put the mask back on. And absolutely, if you do touch the outside of your mask, you do want to try to do hand hygiene after that in order to make sure that you have not contaminated yourself.
Just so everyone can see, if you're looking at the chat, Philip Stokes here in the Pi Center has just posted in the chat a video from one of the other NIOSH Ag Safety Centers to kind of answer that question too, on how to put on and take off a mask. And as I said before, our Southeastern Coastal Center is one of the 11 NIOSH Ag Safety Centers across the country, and all of the Ag Safety Centers are working at a feverish pace to try to do exactly what we're doing here, which is to provide you with as close to as up-to-date information as possible in ways that we hope that you'll be able to take this and to educate and inform the various people that you'll be working with, whether as extension agents, or I can see on the attendees today, we have several individuals from some of the major agricultural associations across the state of Florida, to your employees and workers as well. See if there's any other questions, but I think we're running, we have a few more minutes, but I don't want to extend this past a time if we don't need to do so. But I just want to thank the other panelists today for your time. As Dr. Prince mentioned, her information, her website, well, not website, but her email address is right there, cap5@ufl.edu. If you have some specific questions, please feel free to reach out to her. and either she can provide you with information or she will find the person who will have the information. I also wanted to mention Dr. Glenn Morris, who's the director for the Emerging Pathogens Institute. He's also the director of this Ag Safety Center. He's also available to answer questions more on the health-related issues related to COVID-19. So I don't know if anyone else has any other further questions or comments from the panelists. But hearing none, I'm going to turn it back over to Philip to end our presentation today.